Hi, welcome back to the channel. Hope you're well. Thank you for being here. My name is Willow. I'm Althea Ward, and I also go by Moscow and Mossy. And today we're going to talk a little bit about my HRT. HRT stands for hormone replacement therapy journey. I wanted to talk a little bit about what has happened with my process. So I'm a year into what is referred to as social transition, where I change parts of the way I sound, the way I look, and the way I present, the pronouns. There's a whole bunch of different stages: laser hair removal, diet, and things of that form, I guess. Since about September, I have been trying to basically pursue what is called the informed consent model through my GP, but I've had some snags because of some health things that I wanted to talk about today, because it's sort of impacted my last few months and my mental health in the last little while. Basically, I have a history of breast cancer in my family, and my mother has had it, and it has severely impacted her life. She's in recovery, I think, now, but it was bad. My auntie had it. They caught it early because of screening and yearly mammograms, stuff like that. And so she had a surgery, but she didn't do chemo. My mum did do chemo and radiation. And my great auntie, Gwen, my mum's auntie, I think that's what great aunties are, she also had it bad. So I've had 3, but only 2 in my direct family. The direct family is the more pertinent in this particular case. And so, yeah, I guess that's sort of where I am with. I didn't really realize that was a factor for me moving through this process until I guess maybe February or so of this year, when I saw a GP, a doctor, about if this was a problem, and he actually said that he would not prescribe me HRT because of my familial breast cancer history, and that he suggested that I potentially had something called the BRCA1 gene. Now, firstly, I'm a bit of like a informed consent absolutist. I think that if you go to a clinic that performs informed consent and they say that, and you understand the risks as a patient, I think it becomes a bit unclear and morally grey-areaed for me when you then go to a doctor and they withdraw your ability to do HRT. Nonetheless, I understand why he said that, but the BRCA1 gene is a gene that quite a lot of people have, that is a gene that heightens your risk of getting hereditary breast cancer in a way that is significantly above the baseline risk for women, cis and trans. And so it is a thing that is screened for in Australia, and is, if you have the gene, you can actually get a mastectomy, removing the breast tissue of both breasts, which will be covered under the Medicare scheme that we have in this country. And as a result, it's very much encouraged to get that, I suppose. Basically, I do not think I have the BRCA1 gene because of the way that my mum has spoken about this, because I don't think either of my mum or my auntie have had this gene, and I do think my mum was screened for it. I know my cousin has been screened for it and didn't have the gene. Nevertheless, this obviously threw a spanner in the works of my process to get on HRT. As I mentioned earlier, in September, I started to really feel like I needed to move the timeline of my medical transition up, and as a result, I wanted to start HRT sooner than I thought, which is not uncommon, I don't think. And so I tried to see basically about something called SERMs. SERMs is an acronym that stands for Selective Estrogen Receptor Modifiers, I think, and it is a medication largely used in post-breast cancer menopausal cis women who need to try to reduce the risk of breast cancer moving forward because estrogen is still in their body. So it protects against certain hormonally responsive kinds of cancer, in this case breast cancer. So sometimes in very experimental cases, trans people, trans feminine, trans women, non-binary, trans femmes, whatever you want to call it, will use SERMs as well as either estrogen or a testosterone blocker, and they will do that to basically stunt the breast tissue development, but to allow other feminizing effects of HRT and estrogen. This is kind of an experimental field. There is not a lot written about SERMs and trans female, trans feminine identities and bodies, but it is a thing that is a part of this world. If you bring SERMs up in a lot of the online forums and Reddit pages that are about HRT, they do not get a very good... I've sort of stopped bringing them up in these circles because I find that it is hard to have a nuanced conversation. Also, most people haven't sat down like I have with two different specialists and actually spoken about it. A lot of people, which is understandable, but I'm going to accept what two specialists and 3 different GPs have told me over what internet strangers are going to tell me about SERMs on Reddit. That's just my personal opinion. And I have the money and access to see those specialists. So that's how I feel. That's just my preference. I wanted to then see a different specialist through the main hospital in the city that I live in. So that's what I did. The wait was like 2 or 3 months, so it was quite a serious wait. In the meantime, I organized other elements of getting ready to start this process, like, as I mentioned in a previous video, the fertility clinic visit that I had. And so yeah, I had that appointment with the specialist at what's called a sexual and gender health clinic, and they were very open about potentially starting me on a SERM, but at the same time as I've progressed through this, I have also realized potentially that I actually do want to experience breast growth and breast development, and I don't know if I feel super comfortable manipulating the way that HRT will affect me, because in some sense I do want the full effect of it. And I wasn't necessarily sure that I wanted that when I started, and there was an element of wanting to pursue SERMs in some sense as an aesthetic thing to reduce or totally prevent breast development. As I've pursued this path and realized that I can probably get onto SERMs, because most general practicing doctors, whatever you call them, aren't specialized enough in this. They won't help transgender patients, so you need to end up seeing why I've seen these specialists, I suppose. I think I've realized that I don't know if I'm actually that comfortable pursuing SERMs, but it also depends on the risk level. So it will always be a heightened risk. At the sexual health and gender health clinic that I went to, they will do a BRCA gene test on me and see what the heightened risk is. I presume it will come back negative, but it is important to know the risk. There are obviously other trans people in this case that have this gene or that have a higher risk like I do, but I've spent about a year calculating that risk, and I don't know necessarily if I want SERMs like I thought I did. There isn't a lot of data on trans individuals taking SERMs with estrogen and a testosterone blocker for a very long time. We also don't have that much information on cis women taking SERMs for longer than, say, a decade or so. I did ask when I saw my specialist at the hospital about the toxicity, because I have heard other trans people expressing the idea that SERMs are kind of toxic to take for long periods of times. They had no idea. They did not agree with that statement. They asked me toxic how? Toxic to what? And I didn't know how to respond because I'd just heard people on Reddit calling them toxic. That appointment left me feeling a little bit confused and sad. I also didn't realize that I would have to wait so long for the checkup appointment. After that, the second appointment, which is happening next month, but I guess I'm not super sure. I will do the next appointment. I have to do my bloods as well, which I'll do before that. And I guess I'll just move on from that. I may end up just doing what's called the normal informed consent route, where I will literally just do HRT as most people do, using either a estrogen and a testosterone blocker. That's kind of the most common way. So I'm not exactly sure what I will do, because I've been left feeling strangely, I guess, sad about the potential for stunting breast growth. SERMs, I believe, have a kind of effect on breast development that is permanent. So you can't just stop taking SERMs and then start, you know what I mean? These are two distinct paths, these using different medications to cater to different health needs within HRT and transitioning. So that's where I'm at the moment. I think I will probably end up going without them, but I don't necessarily know yet. That's kind of where I'm at. So it's a bit of a crossroads, but I know that one of the two options will be used. And yeah, that's all I wanted to say. Thank you so much for listening. Let me know what you think about this. Let me know if you have any questions about HRT for transgender individuals. Let me know if you have any comments, and I will answer and read all of them. Please subscribe. Thank you. Bye. Okay.